make health whole really is essentially what we're striving for. So I'll try and touch on some of the highlights of what we've done over the past few years and this past year in particular. First of all, a little bit about Salud. We have a pretty broad geographic span across Northeast, North Central Colorado, and also now down south in Trinidad. So we have a wide range of clinics actually expanding, or that could be characterized as rural, suburban, and urban. We have a very large Spanish-speaking population. About 64% of our total population identifies as Latino or Hispanic, and the vast majority of those identify as Spanish speakers. So culturally appropriate care and linguistically appropriate care is something that we really strive for, certainly as it relates to reducing barriers to accessing behavioral health services. And that's something that our postdocs have done very, very effectively. And I say that because for a couple reasons. Number one, they identify as Latino or Hispanic themselves, but perhaps more importantly, they're bilingual. And so, just eliminating a linguistic barrier as a factor for limiting access to care is something that's been really, really critical. So this past year, we had a fellow placed in our Frederick, Commerce City, and Brighton clinics. I do have a report due at the end of the month, and I'm kicking myself. I wasn't able to get all of the numbers together for this call today, but I will by the end of the month, of course. So I don't have the exact number of individual patients seen just yet, but I would say is that their individual productivity in both overall total encounters and unique patient seen grew throughout the year, as did, and in particular in recent months, since about March. And one thing I'll mention is that the percent of patients seen on the medical floor or for a medical visit that was also seen by behavioral health as a clinic increased exponentially throughout the year as well. So generally in an integrated primary care model, if we're able to see about 20% of the patients also seen in medical in the field of integrated primary care, that's generally considered pretty good. And in some of our clinics, including the clinics where these postdocs were housed, we got as high as upper 20s, 30, and even 40%. So, when you consider that as many as half of the patients with an identified need, national statistics would indicate, national data would indicate that as many as half the patients with an identified behavioral health need, mental health or substance abuse, still do not receive care. Again, we try to be very, very mindful of that. And reduce any and all barriers to accessing care, reducing stigma, providing psychoeducation around what behavioral health, mental health services are, just making ourselves, reducing a lot of the logistical barriers to care. So the clinical role of these postdoctoral fellows is either primary prevention screening, whether the patient is asking for it or expecting it or not, consultation or warm handoff with the medical provider as a behavioral health concern is identified in the exam room or in the context of the medical visit. We also do brief short-term therapy. And in the case of the postdoctoral fellows, we also have some unique services that they are able to offer, including psychological testing. That is typically only done by a licensed psychologist, but because they are under the supervision of a licensed psychologist as fellows, they're able to conduct some of these, for example, IQ and achievement testing that often, like everything else, is most likely to present to primary care first and foremost. So we're able to address that need where the community otherwise would not be able to address that need, or where services otherwise may not be available.
I want to, what's that?
Jeff, do you want to jump in? I want to make sure I'm mindful of time.
Yeah, hi. So yeah, thank you so much, Jonathan. And I guess my one question for you would be if there was one thing that you would take away or that you and your colleagues at Salud have taken away from the evaluation activities under the Colorado Health Access Fund, what would that be? Can you name one thing that maybe you learned throughout the course of these 3 years that came about as kind of doing self-evaluation of your program?
You know, it's hard to name one thing. If I had to, I do think it would probably fall under the umbrella of sustainability. So um, it was essential for us to be able to hire these postdocs through the grant fund when we did, because that was also prior to us acquiring billing contracts with what was then the BHOs, which actually, given all of our regions, that took actually a couple years to have in place. And now we're kind of through that. We had, relatively solid funding billing model. And as was mentioned earlier, here now we are up against this change into the Ray model and ACC phase 2. And there's, there's different types of uncertainties about financial sustainability and, how things are going to be sustainable from a financial model. And we're confident. We think we're in pretty good shape. But I would also fit under sustainability, I would say, from a recruitment and retention standpoint of future postdoctoral fellows and kind of expanding the pool that we're able to draw from. We've really kind of solidified the program as a whole, and we feel confident that now we're going to be able to bring in consistent, bilingual, doctoral level, high quality candidates, and we now will be able to sustain that financially on our own, independent of the grant. So I hope that answers the question, but I think it's all under the realm of sustainability, and there's more to it than that. We've led several recruiting efforts. I wanted to mention that 2 of the 3 postdocs this year are actually native Puerto Ricans, so they're native Spanish speakers, and they've done a lot to bring in even practicum students or kind of graduate level trainees to help provide services in our clinics. So we, in a sense, have sort of an international pipeline and have brought it to an international scale. We also have an exchange program in conjunction with the University of Denver's Graduate School of Psychology. We have an international exchange program with a university in Chile, and we now have 4 students from Chile that are under the supervision of these postdoctoral fellows. And so but from a sustainability standpoint and expansion of services and really meeting the workforce needs and future workforce development, we really think we've solidified things and training future generations of practitioners.
Great. Well, thank you, Jonathan, very much for sharing, and congratulations on your accomplishments and over these 3 years. And if others have questions specifically for Jonathan, feel free to use the chat feature, or if you'd like to be connected to Jonathan directly, I can certainly facilitate that as well. So just feel free to get in touch with me offline. But the second grantee that I invited to share today is the Health District of Northern Larimer County. And we've got Suman Mathur with us today. I was up at a conference at the Public Health in the Rockies conference and was pleased to see that the Health District had actually had a poster presentation up there of their program that they had implemented in part as part of the Colorado Health Access Fund. So I thought it would be great for Suman to share her and her colleagues' findings around the program. And I'm going to turn it over. It looks like you've got quite a few colleagues there in the room. So hopefully we will unmute you. I think you're unmuted now. And turn it over to you for some, we'll do your brief comments, and then I've got the same question for you as to what you've learned from your evaluation.
Yeah, of course. Yeah, we do have a whole crew here, so I'm actually going to turn it back over to Jessica just to kind of get us going. Yeah, so just to give a little bit of a lay of the land about our program and our goal, we are part of the SIM Collaborative Grant. So the two grants funded our child, adolescent, and young adult connections team, and the goal was really to make sure that 0 to 24-year-olds are assessed and referred to the right treatment community provider for behavioral health in our community. And so, because navigating what we found is navigating that system is very complex, and that parents are often left wondering that alone. So the Denver Foundation, the CHA funds primarily funds our psychologists on the team, who has really helped us to increase access to testing services. Since access to testing was really costly and there are only 2 other providers in our community. And then the CDPHE grant, the SIM funds, fund our navigator, who help us to get those kiddos, once they're tested, to the right treatment provider in the community. And then we also have a school liaison that works with the schools to identify kids and get them in for testing and then referral to the right provider. And then finally, the health district, we fund the psychologist. And so what really makes our program unique is that we have a psychologist on staff, psychiatrist on staff and a psychologist funded through Denver Foundation. And so we're able to staff both of those. We're able to staff every case, every client with both our psychologist and our psychiatrist to really identify what the true issue is as quickly as possible and to get them out into the community with the right provider as efficiently as possible. So that's a little bit just to navigate what we're doing and what our goals have been. And I will say, just before we jump into our big evaluation learning, these grants have been so critical in us being able to form this team and to show the value of this program. And we as well are going to be able to sustain this program long term because of the comprehensive evaluation we've been able to do because of the funding. So thank you.
Yeah, so I just wanted to share some takeaways from our evaluation. And so I would say one big takeaway is that we've been able to integrate the evaluation work into our overall workflow here at the Health District. So we're fortunate to have a pretty small but mighty internal evaluation team. And we have designated FTE that we can use to evaluate the kayak program that Jessica mentioned. And so last year, we really took a step back and tried to do a lot of work sort of on the front end to figure out how can we better integrate the evaluation work needed for this program into sort of the other evaluations that we're already doing here at the Health District. So that involved looking at our other programs and seeing what tools and evaluation techniques we could replicate that would fit the evaluation needs for this grant and for this program. But we also really needed to be mindful that kayak is a unique and new program, and because of that, we needed new evaluation tools. And so I'd say that one thing that was really critical in helping us out or figure that out was to shadow and observe the staff and the kayak team. So when I came on board, I spent a lot of time with our program staff just to get a sense of what was happening and how can we really make the evaluation useful for the team as well as for sort of these bigger picture questions about the grant. And so that also, I think, really helped smooth out our data collection process. So one issue that we had come up initially was the opt-in for our client survey, which composes the bulk of our evaluation, or a big portion of our evaluation work. And since our clients are kids, there were some extra steps that we needed to go to make sure that we could survey those clients and their families if needed. And so really working closely with our program staff and literally going to the front desk and seeing what buttons they needed to push in order for us to figure out whether or not we could survey someone was something that took a little while to figure out. But now that we have gotten past those hurdles, it really is a lot smoother sailing from here. So yeah, I would say overall being able to work in a lot of the various components of our evaluation into sort of our ongoing processes not only makes it a lot smoother for us, but I think it also helps with sustainability in terms of thinking about evaluating this program ongoing. We have a way of doing that without it being such an additional burden on our work. And one other thing that sort of came up unexpectedly is that due to the nature of a lot of our data collection, we ended up getting a lot of qualitative data, which was awesome. We had some really rich pieces of data, but we also knew that qualitative data takes longer to sort through and to really use in a way that is valuable and informative. So if you are evaluating a program and you're doing something that lends to a lot of qualitative data collection, to really think through how you're going to work with that.
So, Suman, sorry to interrupt you, but could you share maybe an example of how you have used that qualitative data in your operations?
Yeah, and Jessica can probably speak to this a little better than I can, so I'm going to go ahead and
one of the things that we found in some of our initial surveys of our client data that we collected qualitative feedback was that there was some confusion around the language we were using when we would intake a client. So we were using the language intake to bring in our clients into care at Kayak, but it's short term. The goal is that we're not their home. We're a place for them to find resources and to come back to if the resources aren't working, but not necessarily to be the home care for them or their care home for them. And so there was a disconnect. We learned that from the feedback, the qualitative feedback, that a lot of clients thought intake, so they thought that, well, this is now where I go for care. What do you mean I have to go somewhere else now? So that was found pretty early. So that came up with evaluation. And so because there's this constant communication stream between the program and the evaluation team, they said, hey, we're receiving feedback from this, that clients are kind of confused about what intake means, and that it's leading to some frustration around them feeling like, well, now I have to go somewhere else. So now, because of that, our Kayak team on the ground were able to adjust their language so that, and to better explain to clients up front that the nature of the services were short term. That really helped.
Great.
I think and I think that the biggest things I can say from kind of being at the bird's eye view between our program side and our evaluation side is that we have a continuous feedback communication loop. So when they are seeing that data that leads to an issue with our program, we're able to better clarify. So for instance, one other thing that came up with some of our providers, we partner with primary care providers to get referrals from them. And we were finding that some of them thought that we were duplicative of the efforts that they could do. So they didn't see why referring to Kayak was a benefit when they could just refer out to somebody they knew in the community. So because of that, again, evaluation alerted our program side, and then our program side was able to go back into those the primary care practices and do some updated training and provide them with additional information on how we operate. And then when it came back on our next iteration of the survey, when we went back to primary care providers, they all recognized, saw the value, and felt that the team was helping their clients to access services quickly.
Great. Well, thank you to you and your team for sharing today. And again, congratulations to you too for your accomplishments over the course of the Colorado Health Access Fund. I believe you all have another year left on your grant. Is that right? I think that's...
Our funding was, yes, we did have some savings, so we're proposing a year 4 budget extension through 2019 for the Colorado Health Access Fund, and then the CDPHE funds due end July 31st.
Okay. Well, we would love to hear more in the future about your plans for sustainability. As we mentioned, that's a really guiding principle for these funds. We are almost out of time today. I would just also say if anybody had any questions for the Health District of Northern Larimer County team as well, feel free to use the chat in the remaining minute or so that we have, or you know how to get a hold of me or Alex on email too, and we can put you in touch. But we are at the close of our time. I just wanted to thank again Jonathan from Salud and the team from the Health District for sharing your accomplishments. I also wanted to just acknowledge those of you who are on the phone as well, whose grants may be coming to an end this year too. Thank you for joining us, and congratulations on all of your good work as well. We look forward to hearing or reading your reports and hearing from you. A couple just closing comments. We apologize for the technical difficulties, but it looks like everybody was able to join us again. Alex, are there any other questions or comments from the chat that you would highlight?
No. It makes sense to send those out to the
Okay. And Cindy and Steph from the Denver Foundation, any closing remarks from you? Oh, you're on mute.
Okay, that's
There
better.
you are.
Thanks everybody for joining the call today. Again, we look forward to seeing those of you who can join us in October. And as always, feel free to reach out to us with questions or comments. And I know Alex and Jeff are always open to having those communications as well. So thanks and have a great rest of your afternoon.
Yeah, so thank you everybody, and we'll be sending more information to those of you who will be participating in the Learning Circle over the coming weeks, and we look forward to interacting with you again. So thanks again for your time today. Take care.